A common question I get asked is, does OCD get worse with age? I'm Dr. Patrick McGrath, the Chief Clinical Officer at NOCD, and I'm excited to talk to you today about obsessive-compulsive disorder, something that I've devoted 25 years of my life to treating. If you're looking for help for OCD, check us out at NOCD.com, and if you like some of the content that we've produced, subscribe to our Get to Know OCD podcast. I haven't seen OCD get worse with age, but I've definitely seen it seem to get more stuck with age, where people doing more and more compulsions over time really do start to believe that the reason everything in their life is okay is because of the compulsions, and they fear that if they weren't doing the compulsions, bad things would definitely happen. This is tough for me as a therapist because I've got to help crack through that shell of belief that people hold on to about compulsions being something that are potentially good to do or helpful to do. Never have we suggested to anyone, hey, it looks like things are tough. Have you considered some obsessive compulsive disorder? Have you thought about doing some compulsions? That has never been the suggestion of any mental health provider or physical health provider that I know of. No one wants you to develop or get OCD or to even maintain it. If you would like to be able to grow older and not have OCD in the driver's seat of your life, there are definitely things that you can do. First of all, find yourself a therapist who is well trained in diagnosing and treating obsessive compulsive disorder. Know providers who give medications out and give them at the right dosages for OCD so that the effectiveness will be there for you if that happens to be the route that you choose for treatment. And really educate yourself and those around you about OCD. There is tons of content out there. There is great information out there about how to remove OCD from your life as much as possible. There's 5 quick things you can do right away. Number 1, don't avoid things you're afraid of, but start living your life and going back out there in the world. Number 2, do it without being told you'll be fine and everything will be okay. Eliminate all the reassurance that OCD demands. Number 3, go do it and face it. Don't have your phone in your hand and focus on all sorts of other things while you're doing the stuff you fear. Fully engage in it. Number 4, do it sober. Don't take any substances as a way to try to manage this, right? Allow yourself to feel the feelings. And number 5, eliminate the compulsions as much as possible, both the physical and the mental ones. Those mental compulsions, they might be harder to recognize. And again, that's why it's so important to reach out to a specialist for treatment, because they're trained in recognizing both the physical and the mental side of compulsive behaviors. If you're looking for help for OCD, we've got you covered. Check us out at NOCD.com and meet with a therapist who can help you live the life that you want to live and not the life that OCD wants you to live. It's really important to meet with a therapist that specializes in the treatment of obsessive compulsive disorder. And, not shocking, you might have doubts about if somebody is specialized in OCD. So guess what? Ask them questions. Find out what their training is. Be sure that they know what exposure and response prevention therapy looks like and how to provide it to people with OCD. Find out how many people they've treated in the past who have OCD and what the results have been. It is okay to ask these questions and to assure that you find a specialist and not someone who just says they are.